Well, September is PKD Awareness Month, and it's an opportunity to spread the word about polycystic kidney disease.
Yeah, an incurable genetic condition, PKD, affects over 600,000 Americans. I had a chance to sit down and speak with a survivor.
When we would perform, I would be petrified that I would feel sick and faint on stage.
Polycystic kidney disease has made it difficult for Linda Leibowitz to travel or perform with her band, two things she truly enjoys. But beyond affecting her quality of life, the condition has also led to a host of other serious medical issues and left emotional scars.
I have been an emotional, anxious wreck. Every time I turned around, there was something else that was wrong with me.
Polycystic kidney disease, or PKD, affects over 600,000 Americans and more than 1 million people worldwide. It is a genetic disorder that causes fluid-filled cysts to grow in your kidneys, enlarging them, some as big as the size of footballs. It often leads to organ failure or dialysis.
We actually have a normal kidney, very smooth contour. There is no cysts. You can see all the sections very clearly. Here is a kidney that is affected by polycystic kidney disease.
Dr. Hee-Dok Khan is a nephrologist at New York Presbyterian Columbia University Irving Medical Center. As head of the PKD Foundation Center of Excellence at Columbia, Dr. Khan believes raising awareness is important because the condition, other than blood in the urine and pain in the flanks, often presents itself as asymptomatic and is discovered incidentally or not until it's in an advanced stage.
We really do want to prevent those episodes and those stories where patients find out about polycystic kidney disease right before they require dialysis or require transplant.
In a small number of cases, the mutation develops on its own, but it is most often passed from parent to child. Linda Leibowitz was adopted and did not learn of her own affliction until she was in her mid-30s, when her then 5-year-old son was diagnosed and doctors told her he had inherited the gene. Like many patients, her condition was fairly stable for decades until her 50s, when she was hit with the harsh reality that her medical issues were not limited to the kidneys.
Am I going to have to go on dialysis? How can I find a kidney?
PKD can lead to other debilitating conditions. Linda develops cysts in her pancreas and liver, high blood pressure, and has vision and GI issues. Dr. Hahn says PKD cells eventually impact other organs, including the brain.
One of the most dire complications that patients with polycystic kidney disease have to be aware of is development of brain aneurysm, which develops due to weakening of a blood vessel in the brain.
He says while there's no cure, medical advances have led to genetic testing, which has been a game changer in diagnosis and deciding on course of treatment. In Linda's case, she ultimately needed a new kidney. After a lengthy amount of time on the organ donor list, she recently underwent a transplant.
My donor, Richard, was so adamant about doing this. He had wanted to donate for years.
The transplant was a success. Linda has been involved in the PKD Foundation for years, and she's redoubling her efforts to educate others and raise funds for research.
I always wanted to be there to help the next person because I know what I went through, and that's my goal for the future.
And Linda also points out that the PKD Foundation provides many resources that were not available to patients decades ago when she was first diagnosed. They include a support hotline to call, as well as them pairing you with someone to talk to. Now, other medical advancements include a new drug that may slow the progression of cysts. But again, there's currently no cure for PKD.